So thank you so much, everyone, for being here for my presentation. So I'm presenting on applying Indigenous, oh, I can't move you out of the screen. There we go. Evaluation methodologies to a program evaluation framework that I developed for the Better Together project. So I want to acknowledge today that I'm joining you from what is colonially known as Calgary, which is located on Treaty 7 territory, the traditional and present-day homelands of many diverse Indigenous groups, including the Blackfoot Confederacy, which consists of the Siksika, the Piikani, and the Kainai First Nations, the Tsuut'ina First Nation and Stoney Nakoda, including Chiniki, Bearspaw, and Goodstoney First Nations. And the city of Calgary, where I'm located, is home to the Otipemisiwak Métis Nation within Alberta Districts 5 and 6. And I'm a very grateful guest here in Treaty 7 territory. I'm originally from Saskatoon, which is located in Treaty 6 territory, and I'm a member of the Otipemisiwak Métis Nation within Alberta. So very grateful to live on this territory. So a bit of background for my project. So I don't need to explain to this group of, very well-versed public health individuals, but Indigenous peoples within Canada experience significant disparities in health and health outcomes as a result of colonization. And this is related to several factors, including the loss of connection to culture and community, impacts on the social determinants of health, and disparities in access to culturally safe healthcare and systemic racism while experiencing care all further drive these disparities. And I see the downstream effects of this in my daytime job where I work as a physician here in Calgary. And I share this is because what drove me to pursue a master's of public health through the University of Victoria so that I could better understand upstream and more preventative methods and look at health systems transformation to engage with Indigenous communities and to improve Indigenous health and health outcomes. So that brings me to my practicum project, where I completed my practicum placement with what's called the Collaborative Applied Research for Equity in Health Policy and Systems, or the CARE Research Lab, under the supervision of Dr. Stephanie Montesanti, who's a CIHR-funded scholar and a Canada Research Chair in Health Systems Integration. And my work was specifically supporting what's called the Better Together project through evaluation activities and creation of a proposed evaluation framework for the project. So the Better Together project is a community-led partnership located in the regional municipality of Wood Buffalo in Alberta, Canada. And it's a partnership between the Athabasca Tribal Council, Alberta Health Services, and the Northern Lights Health Foundation. The overall goals of the Better Together project is to improve the health and wellness of Indigenous peoples in the region through health systems transformation and the creation of an Indigenous wellness space, which will be a place for Indigenous community members to access culturally safe care. The space will be physically located within the Northern Lights Regional Health Center, which is the regional hospital in Fort McMurray. And it will be a place to access culturally safe healing practices, honor local healing traditions, and provide opportunities for collaboration between elders, knowledge keepers, and healthcare providers. The first phase of the Better Together project was understanding health service utilization and experiences while accessing care for Indigenous peoples in the region. And now the project has moved on to phase 1B, which is the service planning and design of the space, which is anticipated to be completed in 2027. So to share a little bit of background to understand how we came up with our program evaluation framework, we based it and adapted the Better Together project framework, which was created in collaboration with Indigenous community elders, knowledge keepers, utilizing the medicine wheel and kinship circle to guide the systems of change for the project. And so the core values of the project are cultural reawakening, cultural safety, increasing healthcare access, and creation of a safe space for engagement and renewal. So this now brings me to my culminating project specifically, which was to create a proposed evaluation framework for the Better Together project. And I will walk through how we approached this next, starting with a literature review of Indigenous program evaluation literature, reviewing existing program evaluations and tools, and then applying a framework to the Better Together project framework to define the evaluation questions and activities. So the first step that I took was performing a literature review to understand the approach to Indigenous program evaluation. And program evaluation in public health has largely evolved from a Western and European paradigm, and many of the theories and frameworks that are used are not necessarily appropriate for use in an Indigenous community context. And so Indigenous research and evaluation paradigms must acknowledge that within settler nation states like Canada, research has typically been performed on Indigenous peoples as opposed to collaboratively with Indigenous groups and communities. And so principles of respect, relevance, reciprocity, and responsibility form a cornerstone of Indigenous program evaluation, as well as community engagement and consultation throughout the process. Next, we considered several existing Indigenous program evaluation tools, models, and frameworks, and considered how we could apply them or adapt them to the Better Together project. We ultimately chose to create the Better Together project evaluation framework by adapting what's called the Urban Indian Health Institute Building the Sacred Evaluation Framework. And Building the Sacred was developed to evaluate programs who are serving Indigenous community members who were survivors of violence. And we chose this specifically because it focuses on evaluation stories that are strengths-based, healing-centered, relevant to the community, and grounded in Indigenous knowledge. And this is a schematic of what Building the Sacred uses to conceptualize the 4 areas of evaluation. And we felt that this could be adapted and modified really well to fit with the medicine wheel and the framework from the Better Together project. So we then took the Building the Sacred framework and we adapted it to the Better Together project framework using these 4 guiding principles and values as a guide. We then took the program objectives and outcomes to create proposed evaluation questions and activities. So here's sort of an example of what I did. So these are the short-term objectives for the Better Together project. And then there also are a set of long-term objectives for the project. And these were developed collaboratively with all of the interest holders of the project and community members. And so these were already created prior to my arrival. So I didn't create these or modify them. But essentially, we looked at each outcome and sort of mapped it to one of the guiding principles and values, even though acknowledging that these principles and values are all interconnected and inseparable. It sort of helped us to kind of conceptualize and be able to map the evaluation activities. And so, for example, one of the short-term objectives is to relieve pressure and reduce visits to the emergency department by providing an alternative space for prevention, wellness, and care. So mapped that to principles of access and safety. And then next, we moved on to defining evaluation questions based on each guiding principle and value, and then those will guide the evaluation activities. We proposed to use a variety of methodologies, such as Indigenous methodologies for knowledge gathering, such as storytelling, conversational interviews, and arts-based methods, and then complemented this with Western evaluation methods for measurements, such as patient chart reviews, auditing processes, and surveys. And so here's just a little excerpt of what I created, which was this big table that kind of separated and classified things by guiding principle, outlined the different evaluation questions. We identified which interest holders would be most interested in that specific evaluation question or that evaluation outcome, and then proposed evaluation activities and what time frame we anticipated those would be completed in, whether they would be short-term, long-term, or ongoing evaluation activities. So, for example, returning to the outcome of the emergency department visit, one of the core evaluation activities in the short term is, has the Indigenous wellness space decreased the need for emergency department visits as intended? And so people who would be interested in that would be community members and the Indigenous wellness space staff. And we plan to propose to do a patient chart review to identify and answer that activity. So, and then I had completed this table with all 4 guiding principles with various questions and activities proposed for each one. So due to the multiple competing priorities for a large project like the Better Together project, and of course the timeline of my master's practicum not necessarily aligning perfectly with the timeline of the Better Together project, there has yet to be significant community engagement, consultation, and feedback on this proposed framework. So I fully anticipate what I provided the Better Together project will be a first draft that will now undergo very, very important steps of community consultation and will undergo further revision. But but provided at least a grounding point and a starting point for asking what types of evaluation questions should be considered. A challenge that we needed to consider was that often within Indigenous program evaluation, the results need to be translated or created into formats that funders or granting agencies are looking for. So making sure that we're asking evaluation questions that will address that without putting an additional burden onto the community is an important consideration. I had to make several assumptions while designing this framework in terms of what staffing the space will look like, external factors such as the changing political environment in Alberta. And then the governance and the funding for the Indigenous wellness space are not exactly completely set in stone yet. So there may still be, so it was hard to define specific evaluation questions around that when it hasn't been completely solidified yet. So those will continue to be added into the model as those details are sorted out. So in conclusion, the Better Together project was an example of Indigenous community-led health systems transformation that was grounded in local Indigenous knowledge, and I was very grateful to learn and to work and learn from all of the community and the partners. And the evaluation framework that we created considered evaluation questions in a culturally appropriate way. So I can see I'm out of time, but just want to acknowledge my supervisor, Dr. Montesanti, all of the Better Together project team members who I worked with, Elliot Young, who is an Indigenous evaluation specialist on Dr. Montesanti's team, who helped me with this framework, Brenda, who was my co-reader, and then Kathy and Monique, who provided lots of wonderful oversight and feedback on my draft. So these were my references, and thank you. Happy to take any questions.